There are several different surgical approaches to forming a double eyelid. These include a suture technique, minimal incision technique, as well as a full incision technique. The minimal incision method involves making 3 incisions along the eyelid crease to create the double eyelid. The suture technique is a minimally invasive method to create a double eyelid crease. It involves using a very fine suture to create the double eyelid. Candidates for this method include those who want to avoid scar, they have thin skin, tend to have more symmetric eyelids, and they want a more natural-looking double eyelid crease. Full incision involves making an incision where the double eyelid crease will form. Patients who benefit from a full incision include those who have heavier eyelids, they may have excess skin or fat to remove. Also, patients who have a baseline asymmetry to their eyelids are more of a candidate for a full incision method. In addition, patients who may have some degree of ptosis that needs to be corrected benefit from a full incision method as well. The recovery period for a full incision method tends to be at about 3 to 4 weeks, with final result being around 3 to 6 months. Anyone can be a candidate for a full incision method. However, not everyone can be a candidate for a suture technique. By that I mean patients who are candidates for a suture technique are typically those with thinner skin. They don't have a lot of excess fat on their eye. Also, they tend to have fairly symmetric eyelids and want a more natural, smaller eyelid crease. For those who are interested in full incision, sometimes these patients also have some ptosis, which would be able to be corrected at the same time as a double eyelid surgery. If you're looking for an overall rejuvenation of the eyelid area, sometimes it's not enough just to do the double eyelid surgery. All in all, it's important to look at the overall eyelid complex, see what areas need to be addressed to give you a more complete rejuvenation.